My name is Alexis Bledsoe, and I'm going to be talking to you about Clostridium difficile, also known as C. diff. I currently work in the healthcare profession as a CNA in a long-term care facility. I come into contact with patients who suffer with this type of infection fairly often. There are special precautions you need to take and how careful you should be when dealing with people who have this type of condition. I am hoping to inform you while better informing myself about the risk and seriousness of C. diff. I will be explaining the type of bacteria C. diff is, how it infects your body, who is at risk, some of the signs and symptoms, and I will also demonstrate how to put on the proper PPE, personal protective equipment, to prevent the spread of C. diff. Clostridium difficile, also known as C. diff, is a species of gram-positive spore-forming bacterium. Clostria are anaerobic mobile bacteria. This bacteria causes inflammation of the colon, and it causes colitis by producing toxins that damage the lining of the colon. This image demonstrates the process of C. diff. First, there is the destruction of normal flora from antibiotics killing good and bad bacteria. Second, the patient ingests the C. diff bacteria, usually while in the hospital because spores are more abundant in that environment. Third, the patient develops the disease and is usually on incubation for 7 days. Before diagnosing C. diff, it must be checked by a stool sample test. C. diff is treated by using other antibiotics such as Flagyl or vancomycin. But in more serious and recurrent cases, you may need surgery to remove the deceased portion of the colon. As shown on the chart, patients 65 and older are at higher risk for contracting C. diff. C. diff is increasingly being recognized as a major cause of gastrointestinal infections worldwide, with 70 to 80% of those infections occurring in adults 65 or higher. Other patients at risk are ones who were recently hospitalized and on recent antibiotics, usually more than one if they are younger. The most common symptoms of mild to moderate Clostridium difficile are watery and mucousy diarrhea 3 or more times a day for 2 or more days, mild abdominal cramping and tenderness. There's also fever, blood in the stool, nausea, dehydration, and weight loss. When coming into contact with someone who has C. diff, there are certain precautions you have to take to not only protect yourself, but also spreading this infection to other people. What I have here is called your PPE, and this is what you would put on before walking into a patient's room who has C. diff. You put this on to protect your clothes so you do not pick up anything if you sit down or anything like that. You tie it behind your neck, and then you make sure this wraps around your body to protect your clothes. And then you simply tie it. And then you put on a pair of gloves, so that way if you touch anything, it doesn't contaminate your hands. When leaving a patient's room, you want to make sure not to touch anything that is exposed that is not covered by the PPE. So you want to carefully remove your gloves like this. You want to touch under this glove where it hasn't been potentially contaminated and pull it off. You'll then take your free hands and untie the back and untie this one. And then you will touch where it's not been contaminated and roll it away from your body, because in case there's anything on the front, you don't want to fling it and end up getting it on yourself. But one of the most important things that people fail to realize is after you've done that and disposed of it in the biohazard containers, you need to wash your hands. Washing your hands is the most important way and effective way to keep from spreading or yourself getting C. diff. When you go into the bathroom, you want to rinse your hands and scrub your hands with soap and water under your nails, in between your fingers, and around your wrist for at least 15 to 20 seconds. You then want to make sure that you don't flick the water to, fling the spores anywhere else. If you want to do that with the water, you can. Then you want to take clean paper towels and completely dry your hands. Washing your hands is one of the most effective and important things you need to do to not only spread C. diff, but plenty of other infections and bacteria that are out there.